So good morning, good afternoon, good evening, depending where you are. You're very welcome to this learning pod on disability inclusion. My name is Mark Cumming. I'm from Comhlámh in Ireland, and I'm also on the forum board, and I'm the moderator for this session today. And I'm delighted that we have an absolutely brilliant panel. And I've seen and heard some of them speak before, and I'm sure you'll be very taken with them. The first person we have up presenting is Talbot Beirne. Lou is Programme Manager for Christian Blind Mission Ireland. She oversees and leads the development of CBM Ireland's programme portfolio in Europe and around the world, with the focus on tackling the double disadvantage of poverty and disability. Lou has 12 years' experience in international programme and volunteer management in Ireland, Ethiopia, Uganda and Malawi, working on psychosocial community development projects. She's also a board member of the Church Mission Society Ireland, and in her spare time, she's an enthusiastic member of the Discovery Gospel Choir, Dublin's leading intercultural choir. So Lou, you're very welcome.
Thanks very much, Mark. Thanks for the enthusiastic introduction. And it really is a privilege to have been asked to present at this session around disability inclusion and volunteering. It's something that we at CBM Ireland feel very strongly about. And we are very excited to have the opportunity to present one of our biggest projects to all of you who are at the session today. So at CBM Ireland, we are leading a consortium of organisations working on the topic of volunteering in humanitarian action for people with disabilities. It's a project funded by the EU Aid Volunteers, and we have been working for the last 18 months on this topic together. So the full title is Technical Assistance in Humanitarian Response, Ensuring Valuable Volunteering and Inclusion of People with Disabilities. So the aims of the project essentially is to create a community of practice of EU-based organisations working towards disability inclusion in humanitarian action and volunteering. And the project has 7 consortium partners from 5 different countries. So the big question is, why do we need to do something like this? So persons with disabilities are estimated to represent 15% of the world's population. And in humanitarian contexts, their mortality rate is 2 to 4 times higher than persons without disabilities. So what we're trying to do is to build on the growing evidence of the need to adapt projects and programs to be more inclusive of people with disabilities. And the United Nations have identified disability inclusive development as an essential condition for a sustainable future. So we're trying to combine the practices of disability inclusion, volunteering, and humanitarian action to bring people with disabilities to the foreground of development. So I'm just going to get into some definitions because I think we all have different understandings of the various concepts that we're looking at in the VIVID project. So persons with disabilities are women, men, girls and boys who have long-term physical, mental, intellectual or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. The CRPD further elaborates that persons with disabilities include those who have long-term physical, mental, intellectual or sensory impairments, which in an interaction with various barriers may hinder their full, sorry, I've just noticed that my definition has a, repeats itself. So I'm going to start again and I'm just going to read the first section.
Okay.
So some definitions here, because we all have different understandings of the various concepts involved in the VIVID project. So persons with disabilities are women, men, girls and boys who have long-term physical, mental, intellectual or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. According to the United Nations Disability Inclusion Strategy, disability inclusion itself is the meaningful participation of persons with disabilities in all their diversity. It is achieved when their rights are promoted and when disability-related concerns are addressed in compliance with the Convention on the Rights of Persons with Disabilities. In terms of inclusion in international volunteering, this is the opportunity for unrestricted participation of persons with impairments in international volunteer services. This concept is in line with the UN CRPD, in particular Article 32, which urges that international cooperation, including international development programs, is inclusive of and accessible to persons with disabilities. This also includes international volunteer services which form part of international development programs. So the project is, we are trying to make it in line with a number of global policies and guidelines. For example, most critically, the UN Convention on the Rights of Persons with Disabilities. Of course, you're all familiar with the 2030 Agenda and the Sustainable Development Goals. And then three other important ones are the IASC guidelines on inclusion of persons with disabilities in humanitarian action, the core humanitarian standards, and the Charter on inclusion of persons with disabilities in humanitarian action. So in terms of what the project has been doing over the last couple of years, we started in around February 2020. Of course, COVID had a big impact on what we were planning on doing. So a number of the events that I'm mentioning had been intended to be face-to-face, but we had to shift them to be online. And actually, as a side note, we learned an awful lot about online events and disability inclusion and accessibility in those times. So just to run quickly through some of the work that we did in 2020 as a consortium, we assessed each organization's needs and where they needed to build capacity on the themes of humanitarian aid, disability inclusion, and volunteering. We had some trainings internally on accessibility and about an introduction to disability, because some of the members of the consortium were new to the concept of disability and had a lot to learn, whereas others, for example, the European Disability Forum, one of our team members, are an organization of people with disabilities. So they led a lot on this work. We also had a conference on inclusive volunteer management that was led by our partner Beatrice Christie. And in fact, there's another conference coming up in December, which I'll mention at the end of my presentation, which reflects a lot of the learning from the past couple of years and should be really interesting and tie in nicely to the conference that you're attending right now. We also did a research report on online inclusive volunteering. Some people with disabilities are unable to travel, and so, but there are still plenty of opportunities for them to contribute to international development and humanitarian aid, and online volunteering is one of them. And lastly, we had some webinars which were open to the public on volunteer management, humanitarian action, and disability inclusion. And then in 2021, we have one of our biggest events that we did was a conference around deinstitutionalization, which was led by our partner Tearfund Ireland, which brought together expert practitioners, care leavers, and disability experts and advocacy experts in the global south. And it looked at the issue of volunteering in orphanages, as well as the importance of not letting orphanages spring up after humanitarian emergencies, and particularly how people with disabilities, children with disabilities, are far more likely to end up in institutions. We also had a big piece of work around inclusive project cycle management training. So this was looking at how we as organizations run our projects from start to finish and how we can be sure to include people with disabilities at every step of the way. So you see there some examples of the topics that we looked at in the pictures. We have disability inclusive client responsiveness. And then in the second picture, a diagram on principles for handling feedback. We also have been doing some very interesting work around digital accessibility. There was a lot more emphasis on digital accessibility than we had anticipated because so much of our work ended up being online due to COVID. So these are three examples of some toolkits that were developed by the project. We have on the left-hand side a toolkit for accessible social media, in the middle a toolkit on accessible PowerPoints, and on the right, a toolkit on accessible Word documents. And all of these can be found on the website for ETF, the European Disability Forum. There was also a guide, which I think many participants in this conference will be interested in, a guide for sending organizations on sending volunteers with disabilities. It's particularly centered around the new European Solidarity Corps, but there's a lot of principles within it that would be very useful for any volunteer sending organization, even those not involved in the European Solidarity Corps. And this also is about to be published and can be viewed on the EDF website as well. So we have a few plans for the final quarter of the project. We're finishing up in early 2022. So we're going to be doing some inclusive security training. This is looking at how we as organizations can support the volunteers that we send and the personnel that we send in their security and safety, and particularly looking at the issue of what are the particular vulnerabilities and risks for sending people with disabilities, and also, of course, the advantages as well. We have one in-person meeting due in Belgium to discuss the legacy of the project. So far, this will be the third in-person meeting. We had hoped, obviously, for a lot more over the years, but at least we're looking forward to this last one. And we're going to be looking at how we can make sure to maintain the learning of the project and to be spreading it to more organizations. So we're very interested if anyone has any questions about the work that we've been doing. We would love to hear from you, because we don't want this to be the kind of project that just has a hard end point at the end of the funding. We're also, of course, going to complete an external evaluation of the project, and we'll be publishing a paper on the lessons learned from our time working in collaboration together on these topics. So we have here just quickly some further information and resources. If you're interested in the accessibility webinars and publications that I mentioned, and including the guide for volunteer sending agencies, you can find those on EDF's website. That's edf-fepf.org. If you're interested in the topic of deinstitutionalization and volunteering, you can find more information on the Cheer Fund website. That's cheerfund.ie. If you're interested in the Inclusive Volunteering Conference that I had mentioned, it's coming up on the 1st of December and will be entirely online. And you can find more information about that at vcvolunteers.ie. And lastly, do feel free to contact me or any of my colleagues, the member organizations from the consortium, about the project and about any further work that we're going to be doing for this. So you'll see my email is there on the slide. It's louise.talbot@cbm.ie. So thank you very much. It was lovely speaking with you all, and I'm looking forward to answering any questions that you have.
Thank you, Lou, for that. So it's my pleasure now to introduce our next two colleagues from bezev. bezev is a German NGO focused on equal opportunities for persons with disabilities in international volunteering. And our first colleague is Jelena Wander. Jelena is project manager for inclusive volunteering at bezev, Disability and Development Cooperation in Germany. Having completed voluntary services and internships in Indonesia, Peru, and Mongolia, she was convinced that the experience of international volunteering should be open to everyone. As a result of this, she's now focusing on the subject of inclusion in voluntary services and tries to break down barriers which are still existing for persons with disabilities and other discriminated groups. She holds a master's degree in social science. Jelena, you're very welcome. And our second colleague is Regina Fuchs. Regina is a sociologist and has been working in the field of human rights and disability inclusion for many years. She's the project manager for inclusive volunteering with bezev, and in addition to the consultation of persons with disability interested in international volunteering, she's also involved in training organizations on the topic of planning and implementing inclusive volunteer services. Regina has an MA in sociology, political science, and gender studies. Regina and Jelena, you're very welcome. Thank you.
Hello and welcome to the Good Practice Pod on Inclusive Volunteering. My name is Regina Fuchs, and together with my colleague, Jelena Wander, we will give you a short introduction of what we are doing here at bezev. We are very happy to have the chance to give you a short introduction on bezev's approach to disability inclusion in volunteering. And we hope to give you some interesting information and go on.
Okay, hello and welcome also from my side. I want to give you just a short introduction in our work. bezev is working in the field of inclusive volunteering since 2008. Participation is a human right, as we already heard today, and therefore we are implementing projects since 2012, which are focusing on the main target of achieving equal participation of persons with impairments and disabilities in state-funded volunteer services. And in all these years, we made experiences with up to 200 volunteers with impairment and disabilities. So volunteering of persons with disabilities is no matter of course. With the following three arguments, we want to outline that disability inclusive volunteering can contribute to greater equality. So first, as Jelena already has pointed out, participation is a human right. And the active participation of persons with disabilities is a way also to tackle discriminatory patterns of thought, because still
persons with disabilities are often seen as passive and as depending on the help and the support of others. So as volunteers, people with disabilities become visible in a very different role. They are perceived as active players. And it is our experience that these positive examples can also serve as a model for other organizations and institutions involved in volunteering. And so by that, the position of persons with disability can be strengthened. And third, our last argument here is that we hope, or we think, that disability inclusive volunteering sector also positively contributes to disability inclusion in development as such.
To reach mainstreaming of disability inclusion, we apply a holistic approach. That means that disability inclusion needs to cover all program levels. The level of the volunteers, the level of the implementing organizations, and the program or political level. And these three levels we will explain now a little bit further.
Well, regarding volunteers or potential volunteers, it is very, very important to directly address the target group. As we realized, at least here in Germany, persons with disabilities very often do not have the relevant information. So what we are doing is, for example, we go to places and to events where we certainly know people with disabilities will be there, and we have accessible information material. So this means we have flyers in easy to read language, or we have videos with a sign language to make sure we are reaching our target group and we get the information where we want it to be. We also offer a counseling service to all interested persons with disability that are interested in doing some volunteering abroad. And we also have the opportunity to link potential volunteers to organizations that already have experience in working with volunteers with disability. And with our peer-to-peer approach, we offer the chance that potential volunteers can talk to former volunteers with disability to get some sort of first-hand information about how things are running and what is important to know and what is important to be considered.
On the level of the implementing organizations, we do much of awareness raising, because organizations often don't have persons with impairment and disabilities in mind. Organizations, that is our experience, are generally open to disability inclusion, but there's a big lack of resources and expertise. To overcome this situation, we offer counseling services for implementing organizations who want to become inclusive or are in the situation of sending or receiving a person with impairment and disability. In this connection, issues can be insurance issues, organizational or financial questions, and support, also the pedagogical support or guidance of persons with impairments and disabilities, or ways of communication. We also offer trainings and workshops. We do this for awareness raising, but also to share the experience and the knowledge which we gathered in all these years of disability inclusion in voluntary services. And we do some networking activities to include all actors in our work. So that means that we connect, for example, persons with impairments and disabilities with implementing organizations, or what we already said, the peer-to-peer broad street journeys with persons further or prospective volunteers with impairment and disabilities. And we developed in all these years also manuals as we evaluated our experiences and brought them into handbooks or checklists, or also information sheets. And with this, we give recommendations of actions to the implementing organizations. So, and to mainstream disability inclusion, the program and political level is not to be forgotten. Here we lobby for increased disability inclusion, and this is, honestly speaking, a pretty rocky road that needs a lot of enthusiasm and as well as perseverance, but still it is really worth doing it. And we also do a data collection and research to have facts to underpin our demands. And following the motto, nothing about us without us, we also support and cooperate with organizations of persons with disabilities, as for example, the People for Inclusion. They also are seen on the photo on the right-hand side. This is a group of returnees with disabilities, and their aim is it to empower others and to encourage organizations to implement a more disability inclusive approach. So far to our short input and our experiences, we hope we could give you some new information, and here you can find our contact details, and we are very happy to receive any questions. Thank you very much.
Thank you for that, Jelena and Regina. Very informative. And finally, I'm delighted to introduce Zulqurnain Asghar. Zulqurnain is the first practicing visually impaired psychologist in the history of South Asia and a member of the Human Rights Commission of Pakistan. He has over 20 years of counselling, training, and research experience, seeking to deploy knowledge and expertise in the disability sector on inclusion, clinical psychology, early childhood education of children living with disabilities, mother and child care, and gender development. He is the author of study reports, policy briefs, and working papers related to disability and political inclusion of people living with disabilities. Zulqurnain, you're very welcome. Thank you.
Thank you, Mark, for introduction. It's an honor for me to present my presentation in International Volunteering Conference. It's very important. Without definition, we cannot understand disability and its inclusion. And to understand better practices, it's also important to have a good understanding of the definition for the audience. And first of all, because definition, if we see the definition of the disability, it's the combination of both biological and sociological. And I will not read out the whole definition because the definition is on the slideshow, so people can understand the definition, because it's the combination of both. And if we see all definition, most of the definition are talking about the both aspects. And second part, disability inclusion. To understand the concept of disability inclusion, we need to understand the barriers. There are though those are not written in the presentation, but for the audience, it's important to understand the barriers, because barriers are mainly 3 or 4 type barriers, and it's important to understand the various barriers hinder the equal participation of person living with disabilities in the society, including disability inclusion, including person living with disabilities in the all spheres of life where they can participate. Basically, those barriers needs to be understood, because those hinder the inclusive volunteering, because it's everyone's right to have full and effective participation in the to enjoy the life, access to equal opportunities. But the first stigma importance of disability inclusion, because it's very important to understand. We need to understand why disability inclusion is important, because we person living with disability, we are consist of 15% of the world population, and without including person living with disabilities, nothing about us without us. Rather, I must say nothing without us. So we need to eradicate the stigma associated to disability first. Second, obstacle which are hindering the participation of person living with disability, which include infrastructural barriers specifically, and those barriers, those, for instance, inaccessible infrastructure, inaccessible buildings, and those are major barriers across the globe. And those barriers, specifically in third world, those barriers hinder the full and effective participation of person living with disabilities. And stigma, because in most of the part of the globe, especially in third world and in Pakistan, because being as I have must say, because our counseling and therapy experience tells us a stigma and discrimination associated to disability hinder the participation of the person living with disabilities or limit their effective participation. And that is the major obstacle, because attitudinal barriers are major obstacle to full and effective inclusion of person living with disabilities as a volunteer. Okay, because it's important to access to all kind of facilities. It's important to generate resources surrounding person living with disabilities, not only generate resources, but provide accessible infrastructure, which is allocation of resources and stuff like that. Pakistan is sixth populous country of the globe, and with the 270 million of population, out of which 33 million are person living with disabilities. Major proportion of them are women living with disabilities. Not only and women living with disabilities have face more discrimination as compared to men living with disabilities, and children living with disabilities are also subject to the conservative practices and norms. Therefore, it's important to include them in volunteering program, and because we need to understand this fact, because if they volunteer, even though all those facts, person living with disabilities are quite a resilient segment of the population, and they're contributing a lot in the voluntary sector. COVID pandemic, it's a major challenge during this era of time, because usually it was SOPs were designed to follow everyone is bound to follow the SOP, which especially hamper or marginalize the person living with disabilities. And we did, we developed with the help of BSO, we developed fully accessible inclusive campaign, and afterward it impacted a lot. Afterward, guideline for to include person living with disabilities were initiated, and the different activities were initiated, and person living with disabilities, they are benefited from the overall arena. Second part is person living with disability participate different kind of things, but major barriers were lack of awareness, because people are not aware of person living with disabilities and their needs, how their needs can be catered, how they can be included in the arena. And that is the main challenge for person living with disabilities across the country. It was discrimination, because discrimination, what I mean, because it's something when people are facing COVID, and person living with disabilities are have double impact on their mental, psychological, and emotional health, and that's why discrimination is play a very vital role. uh, Conservative cultural norms, because it's quite obvious person living with disabilities are subjected to cultural norms, because it was observed that due to cultural practices, they left behind to benefited the um, facilities, health facilities, and different practices. Inaccessible infrastructure play important role because most of the time things are not that much accessible, and it was observed. We have observed this during the pandemic period. Inaccessible mode of communication because most of the advertisement, most of the material was produced. That material was not in accessible formats, and that create trouble for person living with disabilities. I can give you one example. Most of the time, advertisement are not accessible. Sometimes other things like if person living with visual impairment in newspaper, they are not, those newspapers are not accessible for them, and sometimes every person is not educated because most of the people, they don't have access to schools, and it's important to include them in the workforce. It's important that things must be accessible for them. Institutional impediments, but there are but it's important to understand institutional impediments because sometimes when rules or SOPs were formed across the globe, needs of person living with disabilities were neglected. We observed while devising the SOPs, COVID guidelines, somehow we have observed person living with disabilities were missing. There was no data of a person living with disability, how many person living with disability got infected, how many person living with disabilities were subjected to the COVID, and that is the and how many person living with disabilities are working as volunteer across the globe. That this data must be available on the different forum, and that is a major area to be. PMHA's contribution to inclusive volunteering. We have inclusive team of dedicated volunteers, which includes person living with disabilities, women living with disabilities, person having visual impairment, and dedicated lawyers, different people from different walk of lives. And we believe in one thing, that without inclusion cannot be done if a bouquet of the society can be formed together, and sensitization can be increased, and through participation of person living with disabilities in all sphere of life, including political, economical, cultural, socio-cultural, and all the aspect of life. And volunteering is a major portion of it because person living with disabilities are not only, uh, especially help seeker. Most of the time, person living with disabilities have ability to work as a volunteer, as a duty bearer. Engagement of people living with disabilities, nothing without us, because without including 15% of the population, that no health policy, nothing can be completed. It's important across the globe that so person living with disabilities can be included in the decision making forums where we can speak about ourselves. And most of the time it's important also because most of the time people talk on behalf of person living with disabilities. It's important, we should include everyone. Everyone's voice must be included in the decision making forum. Inclusive policy management, I've discussed earlier, because inclusive policy management can increase the volunteerism. Person living with disabilities can include policy formation, policy implementation, and in every aspect of the life and policy making, in 3 steps of policy making. liaison with mainstream organization, it's quite commonly observed across the board. Rather, those are public organization, rather those are corporate organization, and somewhat in development organization. They're working, but they are not including person living with disabilities on decision making forum. That's why it's important to include person living with disabilities as a opinion maker, as a decision maker. Without including this inclusion, other steps may be not that much effective. Accessible infrastructure, I've discussed earlier. And accessible infrastructure is key to inclusion of person living with disabilities, because without accessible infrastructure, nothing can be achieved. It's important to include person living with disabilities. Accessible and alternate mode of communication. For instance, everything must be available in braille, signage must be installed, and advertisement and newspapers and all those things must be during, at least in every time, but especially in COVID time, this could have been done. Capacity building, those their health caregiver, they must be trained how to provide health care to person living with disabilities, because a person living, we have a different lifestyle, because disability is a lifestyle. That's the important thing, where that is our right. The person living with disabilities must be included, and training must be conducted in all walks of life, especially those they are providing care, not only care specifically, but those they are working as to provide health facilities or financial assistance, and every walk of life. Accessible awareness raising campaign, which include sign language, which include braille embossment, which include in indigenous languages, because without accessible campaign in communities, nothing can be achieved. These were the some recommendations, and once again, if you need any further information, if anyone want to ask anything, do contact us on these addresses, and if you have any question, feel free to ask. Thank you.
Thank you, Zulqurnain. Thank you for that. It has been brilliant to listen to the colleagues from Europe and South Asia, sharing on their perspectives, sharing on the challenges, and sharing on the very practical work that people are doing to bring a greater inclusion and greater diversity into international volunteering. We hope you've enjoyed this learning pod, and thank you to those of you who put questions in. So finally, to Lou, to Jelena, to Regina, and to Zulqurnain, thank you all, and good day.